Number is 0916-724-8530 and she's asking, good morning, kung malaki po ba ang varicose, may chance pa po bang matanggal ito?
Dr. Cappuccino?
May chance na matanggal yon. Kaya lang, we need to have several sessions for treatment.
But
kasi
pwedeng gawin to
pero
non-surgically.
pwedeng gawin.
Yes, okay.
Normally, ilan po bang treatments ang advice nyo for the spider webs, the big veins, for the big varicose veins?
Now, normally, ang mga treatments natin is from 2 to 10 sessions, no?
Okay.
So, depende doon sa severity ng varicosities.
Okay, another texter, Kata.
Hi, my doctor told me that sclerotherapy won't treat my varicosities since these are big ones already. What then should I do with it? From Danny Kabud of Quezon City.
Well, I'm sorry to say na pwede siyang tanggalin nung sclerotherapy,
So,
no?
even though na itong mga
Medyo
varicosities
matagal
to,
lang.
yung mga
Kahit
ganyang
malaki.
kalalaki, no? I can
Oo.
be treated by sclerotherapy. Which is kagandahan nito,
Oo,
Kata, this is a non-surgical
Non-surgical.
treatment. Even though the bigger veins, as long it's, there's no signs of deep venous thrombosis, can be treated by surgical
Sclerotherapy.
treatment.
And it's
which is
very affordable
sclerotherapy.
compared to going to a surgical
Correct.
na talagang meron pang fee, doctor's fee,
May hospitalization,
yes.
may scar.
Yeah.
Not to mention the number of days bago sila makabalik sa trabaho
No,
nila.
there's no downtime.
No
downtime.
downtime.
No downtime. Okay, wow. Ang galing, ha? And one thing is non-surgical, you know.
They mentioned na wala daw scar.
No,
Walang
that's
scar.
right. Because it's just an injection, eh.
Injection lang.
So, cotton ball lang.
Cotton ball.
Yes. And later on, we will have a live demonstration of the treatment of varicose vein non-surgically, which will be demonstrated, I think, by Dr. R.L. Ray Ranlao. Ray Ranlao, okay, who is one of the experts too. And this will be live demonstration here only in Global News Network.
Doc, I have a question. Alan po ba yung areas na tinatamaan ng varicose veins among women? Like, normally po ba sa back, sa
Is
feet?
there any other places in the body or location?
Mostly sa legs, ano. Meron din sa arms, meron din sa face. Yung iba sa shoulder area, nagkakaroon din. But most na ang mga present doon is either the reticular veins or the spider veins na nakikita.
Is it deadly po ba if we inject it in some of the areas na close to the heart? Or does it really matter? Okay
Doesn't really matter kasi what we're treating is yung veins lang na present. So, local lang talaga. Hindi, the sclerosing agent is not supposed to go into the circulation but treat the actual deceased vein present.
Again, we have another texter. Wow, ang layo, from Cagayan. Yeah.
May from Cagayan. Meron po ba na topical product na pwede gamitin na alternative to sclerotherapy? My friend said to try the topical product, namely Venscare. Okay po ba yun?
Actually,
any experience about the topical application?
with regards to the topical application in treating varicose veins, no, sad to say, most of them doesn't really work. And it costs too much. Yun yung maraming products available, but most of yung mga feedback natin do sa patients, walang nagagawa din.
Walang effect.
Usually, parang anti-inflammatory effect lang, eh, like just to lessen the bulginess of the varicose vein.
But it still come back.
But it doesn't...
Yung in terms of visibility, hindi po siya, visible pa rin po siya. Hindi
Visible
po siya
pa
talaga.
rin.
Visible pa rin.
Siguro because natatanggal na yung swelling, it may reduce the swelling, but not actually eliminate the varicosities.
You're not really treating the varicose veins, just reducing yung in-improve lang yung appearance, but after a while, nandyan na ulit yun.
Doctors, bakit po women? Bakit women ang laging natatamaan ng mga varicose veins problems? Bakit hindi po men?
I think there's like around 30 to 40% of men have been affected by this kind of disease. So, like for example, patients who are mga seaman, no?
Mga seaman.
Because they are lifting heavy things like even pregnant, because most of these are, sabi nga, hormonal.
Hormonal kasi ang
patients who are also taking hormonal pills because there is a direct effect on the wall of the blood vessels. We call it the tunica intima, that make it loosen and become varicose. Kaya mostly women. It's more of hormonal thing. That's a good thing with varicosities.
Good thing po ba yun or bad thing for women?
Well, this only says that you're a woman. Yeah. Kata, the good thing with varicose vein is that this can be treated nga non-surgically, especially right now, summertime. Kasi pag summer, of course, you're wearing shorts. And if you are fan of
going to the beach,
and let's say, iba, uso ngayon ng badminton. Ang pangit naman kung nagba-badminton ka, naka-jogging pants ka. Di ba? Dapat maganda yung iyong attire.
Outfit.
And even though how nice is your attire, how nice is your skin, your facial skin, or your body, but you got varicosity. So the tendency is just wearing stocking na lang just to cover the varicose veins, diba? That's what they're doing. So ngayon, because of our two experts, there's already a treatment which is non-surgical kasi most of the patients who are affected by this kind of disease is that they thought that varicose vein can only be treated by surgical removal. But now, because of the two experts, we have a non-surgical treatment. Okay. There's again another texter
from Mandaue City, Cebu.
Wow, from Cebu.
Okay.
Maayong, how do you say that? Maayong puntad. Yan. Okay. Alright. Kata?
Okay, she's asking, meron na po akong veins, mga maliliit pa lang, paano po ba ito mawawala? I think she's referring to spider veins.
Oh, spider veins.
Paano ito
Doktora?
mawawala? From Grace Ponce of Mandaue City.
For spider veins, we can inject Sclerodex. Madali lang i-treat yan pag maliliit lang.
Yes. How long
Agad.
How long is the treatment per session?
The
treatment per se. Oh.
Usually 15 to 30 minutes
Wow,
lang, Doc.
fast,
Depende sa kadami ng
So that's why you can
damaged
even go
veins.
during lunch break for the treatment. Oh.
For spider veins po ba, normally 3 sessions lang po yung kailangan? Or umaabot po siya hanggang 10 sessions pa rin?
Now, with regards to that, kaya yung iba umaabot ng matagal. Kasi when we're treating spider veins, usually mga 2 to 3 sessions nawawala na. Problem is, merong lumalabas na bago, gusto na naman nila ipatreat. Kaya we have patients who have been going in and out of the clinic for more than 10 sessions because of the new ones that are appearing on the legs.
Yes, because there was an exposure. Let's say, for example, ang sabi siya ng doktor, prolonged sitting, so dapat uupo ka pa minsan-minsan. Kasi, prolonged standing, so kinakailangan upo ka o prolonged sitting, kailangan you have to move You have to have a pump for your legs to have a blood circulation. Okay, another
Texter.
texter.
And she's asking, my 14-year-old son has varicose. Is it advisable for him to undergo sclerotherapy? Will there be any side effects from
Nueva
Rosa
Vizcaya.
From Nueva Vizcaya?
Lalayo Doktora, 14 years old,
14
can we do
years old.
sclerotherapy?
Yes,
Yes.
we can do sclerotherapy for kahit na ganun yung kabata. No?
Yes.
Anyway, we are treating naman yung mga damaged veins lang.
Okay. Hindi naman po siya age-sensitive.
Hindi naman.
Yes, what do you mean? How young is young and how old is old?
old?
Dr. Zores.
Siguro we can start treating. Usually naman hindi mo to nakikita sa mga bata, no. But the youngest we have is 14, 15 years old.
Yes.
Age of puberty, no? Doon talaga outbreak
Yes, again, another texter from Butuan City. Mabuhay po mga taga-Butuan at
And from Angeles City,
from Anna and
Butuan.
Noemi.
Yes. Ask ko lang magkano per treatment and if babalik po ang varicose pagkatapos ng ilang taon. Saan po ang clinic ninyo? Thank you.
Dr.
Okay,
Zores.
we have a
much daw?
clinic at how much? 4,000 initial and 900 succeeding. And I want
4,000 pesos lang.
4,000
4,000
pesos.
during the first
First treatment. And
During the
succeeding treatment
Succeeding
is only
treatment is 900.
When you say succeeding treatment, that will be how long? I mean, kailan yung succeeding treatment natin?
Now, the succeeding treatment will last up to 6 months.
Ah, wow!
No, I mean, the next treatment will
The
be
next treatment.
After a week.
The next treatment will be after a week.
after a week.
After
So
a
that
week.
means
The
like
earliest-
parang once a week lang ang
Once a week.
treatment natin.
The earliest we can have is after 4 days kung talagang nagmamadaling mawala. That's what we do for those seafarers.
And she's very, very interested, and they've been asking where is our. Maybe later on we will tell you where can you find our doctors, all the addresses and the telephone numbers. Okay, another question from Sampaloc, ang layo, Sampaloc, Manila. Okay, Doktora
Lara is asking, how
prevention.
can we prevent
Varicose
varicose
vein.
veins?
Doktora Cappuccino.
We can prevent it by wearing siguro comfortable shoes, tapos yung mga 1 to 2 inches heels lang na shoes. Also by minimizing prolonged standing and prolonged sitting.
Okay, yeah. And of course, for those patients who are taking hormonal pills, siguro kung talaga namang hindi naman kailangan,
Huwag na lang muna.
Diba? Okay.
Doctors, before and after regimen, during the surgery, ano po ba advice niyo? Are they allowed to take in any vitamins po ba? Or any vitamins or or after or pre-post medications after undergoing?
Actually, there are no after or pre-medications given, but vitamins will help.
Vitamins.
Makakatulong din yon in yung mga antioxidants which prevent yung further damage ng ng cells natin sa katawan, no? But maganda pa rin siyempre ang effect ng mga vitamins. So, pero yung after yung post medications, wala. We do advise them to modify their lifestyle. Kung lagi nakatayo, lagi nakaupo, do something about it. Yung intake nga ng hormonal pills, kung hindi naman kailangan, wag na lang muna. Since if it's hereditary, wala tayong magagawa doon, but we can prevent that, yung lalo na sa mga babae, by advising them to wear, sabi nga ni Dr. Cappuccino, is wear comfortable shoes.
Instead of killer heels.
At saka, the good thing here, Kata, kasi nga, this is isang parang a weekly treatment. So that means that the treatment is tolerable and is easy and is non-surgical. It's very quick. It's only like, maybe sabi nga ni Dr. Cappuccino, it's only like 10 to 20 minutes lang ang treatment. You can go home immediately after.
Go back to your usual activity. If you
Right,
want to go to sports,
so para lang, wala lang, para ka lang, how do you say that? Para ka lang nagpa-spa. Once, wala pong 1 hour. And
or
then
pwede
you
ka
can have the treatment
nagpa-inject
done.
ng glutathione.
So
tapos
easy,
you can go back.
You can go back home. Again, we have
Another texter
from Cavite,
Mrs. Alvarez.
Alvarez, yan.
Pwede po bang maalis ang veins sa arms?
Dr. Azores.
With regards dun sa veins sa arms, kailangan muna nating makita kung ito is normal veins or diseased veins. Kung diseased veins, then we can do something about it.
But you know, those veins in the arms are functional veins.
Most of them.
Usually visible
Most of them
veins
talaga.
lang.
The ones that are visible sa arms are functional veins. Kaya lang, nami-mistake na iba. Akala nila varicose dahil malaki. Actually, it's not.
Sir, in fairness to our viewers, ano po ba yung difference ng diseased vein and a normal vein?
Now, with normal veins are yung normal functioning. Ito is yung dugo is maganda ang flow inside. Now, with diseased veins, ipon lang to ng ipon ng dugo. That's why, in time, palaki siya ng palaki.
Bakit po siya niipon? Kasi wala po activity.
Di-discuss natin yan mamaya.
Okay.
Later on. And later we will also be discussing some of your questions. And please text your questions to 0922-891-6761. And our next segment, we will be doing a live demonstration of the treatment of varicose vein only here in our program What's Up Doc and Global News Network.
Keeps me stronger, brings the sun to shine on me. No matter what you do, wherever I may be, your kiss will.
Yes, and we're back here in What's Up Doc, and now, as I have promised, we will do a live demonstration of the non-surgical treatment of varicose.
Sclerotherapy.
Yes, varicose vein. We call it sclerotherapy. Again, we have our expert here. On my left is, of course, the one who's going to do the demonstration is Dr. Rayron Lau.
Good afternoon, Dr. Cenica.
Yes, of course, Dr. Roderick Azores.
Hello, everyone.
And of course, Dr. Jet Cappuccino. And of course, yung ating nurse, Miss Arlene of Janssen. Okay, now, Dr. Rayron Lau, what kind of case do we have right now?
Okay, first we have a woman. Our patient is a woman.
Female?
Yes, a female. And she's having a spider veins, combination of spider veins,
Yes.
some reticular veins, and some varicose veins. So we have a good demo patient, no?
Okay.
Kasi kompleto siya. So makikita ng audience na yung pagpasok ng gamot later on.
Yes, for our audience, especially for our minors, medyo baka hindi nila maintindihan yung ating treatment, but this is what we call it sclerotherapy. We will try to do a live surgical demo of the treatment of varicose veins. And as I've said, this only takes probably
15 minutes.
maybe
10 to
10 or 15 minutes, right? Okay. So what will be the preparation for here, Dr. Azores?
Before the treatment, first we identify the diseased veins present. No.
Okay.
After that, we sterilize the area by applying.
Dr. Rapuchin, do we have to take the medical history of the patient?
Of course.
course, we need to take the medical history of the patient.
Yes.
We need to take if the patient is allergic to seafoods,
Some
because we
history
have
of
a
allergy. Okay.
and then also other diseases like